going into our first slide, and I hope I get this okay, Rach. There we go. Our program, again, funded through CDC in 2009. We're approaching the 5th year of our grant. Our grant components are directed, and this changed quite a bit. We aren't a full screening program, as breast and cervical cancer program is more targeted toward direct screening or has more funding to do direct screening. Ours is broken out in 3 components, one of them being direct screening, another one public education. So our screening's more toward eligible participants, and I'll go in more on the eligibility in a bit. The public education is targeted to not just our eligible participants, but the full, targeted population, just educating people on colorectal cancer screening. The third component is policy and system changes. So direct screening, public education, policy and systems changes. Our overall program goal is to get screening rates, colorectal cancer screening rates in Iowa from 64% to 80% by 2014. We're moving slow, but we're still trying to tackle that goal in partnership with other resources and programs in the state. Our local program structure, the way we're set up is that we here at IDPH, the Department of Public Health, we receive funding from the CDC. Every state, and we're one of 26 states, tribes, and territories, that receive funding for colorectal cancer screening across the country. So every state is given the option of how they want to structure their program. The way we decided to do it, we were trying to figure out how we could get the most screening statewide as we could with the limited dollars we had. So what we started doing was expanding our program into different areas of the state based on the colorectal cancer smooth maps. We've kind of expanded since then based on, the availability of resources and endoscopists willing to participate in our program in individuals interested in being a part of our program. So right now we just added a new one. So we have 11 local programs statewide. I'm just going to advance the slide so you can see that. This is our map, so we're small and mighty, but we are trying to get as statewide as we can. Our local programs consist of local public health agencies, some of which are on, I know, community health centers, and then we also have a free clinic. One of the new ones we added is really doing a partnership of hospitals, free clinics, local public health agencies. So I'll go into more of the structure and how these local programs are set up in just a minute here. So at the local level, we have a coordinator and a backup coordinator that really work toward, they do case management services for our eligible participants. So our eligibility is 250% of federal poverty level and below, male or female. They have to meet our income guidelines. They have to be uninsured or underinsured. And then as far as screening goes, we provide the fecal immunochemical test as our primary screening method and the colonoscopy as a secondary method. So our coordinators determine the risk level of a patient coming in. So when I say risk level, we have average risk, increased risk, or high risk. Average risk means they don't have a personal or family history of colorectal cancer or precancerous polyps. Increased risk means they have one or the other or both. They have they have a family or personal history of precancerous polyps, colorectal cancer, or both. High risk is when we really, just because we are a prevention program, screening program, our funding does not cover high risk, the high risk population, and it does not cover treatment. So we do, as a program, have had to be thoughtful in how we secure resources for those. We have our programs refer for the high risk category, and then as far as treatment, we take that as it comes, and I'll get more into that. So as I said, the services provided, our local programs enroll participants based on their eligibility. They enroll them into a data system which tracks our program services and follow-up needed. They provide all the case management services, which includes providing them with the fecal immunochemical test, which I'll just abbreviate to FIT. And if they need services such as colonoscopy, it also includes coordinating all the services for endoscopy, the pre-consultation for the endoscopy or the colonoscopy, pharmacy, and anything else that would be needed within that those coordination services. The coordinators also do the billing pieces of things, and they're just really serving as really that patient navigator / case management coordinator for the patient, following them through the whole cycle. And we refer to a cycle as being from the time of enrollment through final diagnosis. And then, as I touched on before, if treatment is needed, we work with our medical advisory board and the specific endoscopy facility that would be working with the patient to secure treatment resources. So we'd find a cancer treatment center in that area to really figure out how they can be enrolled in an assistance program based on their ability to pay. We also have an agreement with the American Cancer Society to do patient navigation once a cancer diagnosis were to be made. Thankfully, we have not had that yet, so we'll take that as it comes and figure out how to work with that patient if that were to be needed in the future. The number of screenings, we are at about half of that number, the 600. We would love to continue that more. And just for various reasons, obviously, colorectal cancer screening is a little bit of a harder sell, which is, Jeanna will go into more of the educational efforts we have in a bit here. But, you know, our screening continues to be slow, and we are trying to, our local coordinators do great work in trying to recruit eligible individuals and just continue to think outside the box to get people enrolled in a program. And the final thing I'll touch on is that we have, when I say limited dollars, you know, through our program, we have also just released a request for proposal for eligible applicants to apply for funding to do additional screenings. We're hoping to tackle more screenings through this, and this RFP process would include colonoscopy only. So there would not be a FIT component to it. It would be strictly colonoscopies. So that is in the works right now, and we hope to increase our screening numbers soon. And that'll all be taking place at the quick time frame for the RFP. So we're hoping to get some more screening numbers nailed out within this contract period yet, ending June 30th.
And Jenny, when are the RFPs due?
The RFPs are due on February 14th, so this week. Happy Valentine's Day. And as far as the time frame, we'll have the contract for the RFP would go into effect in March, so super quick. Just in time for March colorectal cancer awareness. Okay, so now Jeanna will go into more of the social marketing, education, program resources we have available, and some fun slides of some of the resources we have.
All right, thank you, Jenny. I'm going to touch base on some of the resources that we have. Last year, when we did the big push for the March colorectal cancer awareness events, we had a number of different resources due to just reduction of some of the funds and not being able to print. Some of the additional materials were limited, so if anybody has any questions or they have any requests, if you are doing anything relating to colorectal cancer activities in March, please feel free to give me a call. And if we have any of the resources available from last year, I'd be happy to send those your way, but we are out of some of them. So the ones that we still currently have are the Ask Me If I'm Blue stickers, or Ask Me Why I'm Blue. We have the low-cost screening map, the low and reduced cost screening maps, which will show organizations and pharmacies across the state that, and it's not necessarily during the month of March, but they might be doing certain colorectal cancer screening events, distributing free FOBT tests. So I'll touch base on that in a later slide. I'll be showing the coasters, our FIT campaign, educational materials, and then we just included our program website. If anybody wants to kind of look through that, we've got an entire page dedicated to resources that we have. So anything on our webinar today you can find on our I Will Get Screened website as well. Want to make sure that everybody knows that March 1st is the Dress in Blue Day. So Dress in Blue is March 1st, so if you guys, we're encouraging sites to do something blue, either wearing something that's blue, bringing blue treats, anything like that, just to kind of help raise awareness. Screen for Life and the Colorectal Cancer Alliance, both are organizations which have free materials. I do have some of the true-false posters that the Screen for Life has put out. And then the Colorectal Cancer Alliance really does a lot as far as promoting the Dress in Blue Day. And they actually have free downloads that are available if you're interested. Here's the free and low-cost colorectal cancer screening map. This consists of the Iowa Cancer Consortium, reaches out to all the different counties to find out who's doing anything related to screening, to colorectal cancer screening, and then we also incorporated our Iowa Gets Screened sites onto this. So once again, some of the ones with the blue or the purple diamonds, show the Iowa Gets Screened sites, which would provide screening year-round. And then, like I said, the ones that are in blue offer something. It might be a one-time event. It might be something that they offer free FOBT tests at the community health center. So you can actually find this map, which this is a map that was updated last year, and it's in the process. It should be updated within the next couple of weeks. But you can find this screening map on the Iowa Cancer Consortium's website, so the canceriowa.org. It's also on the Iowa Get Screened website. And there's also an accompanying document to it that will show you, so for, say, Sioux County, it will show the contact information as to where somebody can receive a free or low-cost colorectal cancer screening. So you can check that out. These are our drink coasters that we did. It's an educational campaign that we rolled out in probably mid-December. We started off with 4 pilot sites in 2 in rural areas and 2 in urban areas, and we're distributing them to bars, restaurants, and taverns just to kind of get the conversation started. So these are what the 2 campaigns look like. On the back, there's a trivia question and some colorectal cancer kind of educational messaging. There's also the Iowa Get Screened website, and then the phone number that's listed there is actually my number. So if people have questions regarding screening resources, if they have any questions, they can feel free to call me, and then I can hopefully hook them up with the appropriate individuals. So this is something that we did. We ran the pilots for 2 weeks, and then we actually ran the full campaign through the end of January. We did press releases. We actually worked with a lot of the counties that had included increasing colon cancer screenings in their health improvement plan. So we really tried to focus and target bars, restaurants, and taverns in those areas so that we were aligning kind of our campaign with what some of the county health departments were trying to do. So we are going to be doing this campaign again in March. So if anybody has any bars or small restaurants where they actually would serve drink coasters, if anybody has any ideas or suggestions, please feel free to give me a call and let me know, and I'd be happy to reach out to any participating bar that might be interested. We also worked with the Iowa Cancer Consortium, the American Cancer Society, the Department of Family Medicine, and the Comprehensive Cancer Control Program to create this FIT campaign. And so we all know that we want individuals to try to get screened using colonoscopy. However, we know that sometimes that's not feasible. Many people can't afford it. Some people just don't have time for it, and there's just people that just don't want to do it. So what we're really trying to encourage physicians is if somebody's not going to be getting screened using a colonoscopy, to maybe offer or promote the FIT screening. It's basically 4 pieces to this campaign. We created a letter to the physician just kind of telling them about the new sensitive FIT screening tests. We have a survey that we created. There's a FIT flyer, which consists of 3 different documents, and it's pretty technical, and so it's really speaking to physicians. The campaign is geared more towards physicians, but it can go to any healthcare provider or healthcare professional. That's the third one that's just kind of talking about to the patients. And then we created an envelope that has a fit educational message as well. So we've worked with Dr. Levy and Dr. Daly from the University of Iowa, and they have sent this campaign to their Irene Clinic members, but we're also looking at trying to disseminate it to other primary care physicians across the state. So if anybody has any ideas, or if you'd like a copy of this campaign to give to a physician in your area to help educate them on the new FIT screenings, once again, our contact information, both Jenny and mine, will be at the end of the presentation, and so you feel free to contact me about getting this campaign as well. Last year in March, we did a landing page. We purchased ads on Facebook and Hulu, which would draw participants to this landing page where we gave them kind of a call to action. We are either offering information for yourself, or if you are a healthcare provider and you are looking at doing something in your clinic. This is the screenshot from last year's landing page. However, we're in the process of updating this, and so we're going to be running this campaign again. And so this landing page, people can click on the one that says, I'll help myself or a loved one, and it actually just provides colorectal cancer information, kind of where our screening sites are. The other one that says, I'll help my patients and my community, was kind of geared more towards healthcare professionals and really encouraging them to do something at their clinic for, or during the month of March, either handing out free FOBT or FIT tests and processing them for free. If they were able to provide free colonoscopies, there are some centers in the state that do that as well. But just really encouraging the public to do something during the month of March. We also have the patient tool, Now's the Time to Have the Talk. This tool actually provides questions for patients to ask their doctors. So we know that we really want to encourage physicians to talk to their patients about getting screened for colorectal cancer, but we also know that their time is very limited, and it's sometimes a topic that they might miss. So we're really kind of encouraging patients to take responsibility and ask their physicians questions. So right now it's showing, this picture is showing the English version, but if you flip it over on the other side, it's actually all in Spanish. We have disseminated these to over 400 primary care clinics in the state. However, I don't know if you currently have them and you're running low on them, feel free, I can send you another copy. Or if anybody would like one of these for a primary care physician clinic, let me know and I'd be happy to send these out to you. Then we also have the campaigns that we've had for a number of years. They're geared towards specific populations. They were created with focus groups here in Iowa, and then the focus groups came back to help kind of create the final campaigns. So we have the campaigns that target the rural Iowans. So we've got 3 of those. They come in postcards and in kind of a flyer format. We have the African American campaigns, which we have limited amounts of the posters, although I think the consortium has more of those. Once again, we have postcards and then a few posters. There's 4 campaign pieces with that. We have the Hispanic Campaign. We do have limited numbers of these materials. These also come in a postcard and in a flyer form. We're in the process of potentially reprinting more of these, but there are 5 pieces to the Hispanic Campaign. We have the Southeast Asian Campaign. These come in Vietnamese and in English. There's 3 different campaigns. And the one with the gentleman on the left where it says Life is Good, and it's the English version, we've also created a woven grocery tote with this gentleman's picture with this campaign on it. And so we have these grocery totes available. So if anybody's trying to reach out to the Asian population, once again, get in contact with me, and I'd be happy to send you some of the grocery totes. And then this is another campaign piece, and once again, in postcards or the flyers and in the postcards. and then our last campaign for the Southeast Asian. And then we have our new male campaign, which a lot of people haven't seen yet. We're really trying to target men. We know that women tend to maybe frequent their physician a little bit more often and talk to them about getting screened. So we're really trying to reach out to men, promoting these campaigns, like you see the one on the right, to golf courses around the state, kind of trying to hit hardware stores, anywhere where men might be frequenting. So if anybody wants any of these male campaigns, the one on the right is geared a little bit more towards women. So in women's groups or community centers, if they're going to be meeting and you'd like some of these materials, once again, please feel free to let me know and I'd be happy to send these out. And here is our contact information. So if you have any questions about any of the slides, if you have any questions about any of the campaign materials, please feel free to get in touch with either Jenny or myself, and we'd be happy to get those out to you.
Great. Thanks, Jeanna and Jenny, for all those great resources. That was really helpful. So, and as we mentioned before, if anybody has any questions, you can go ahead and type them into the chat box now, or else we'll just save some time at the end for any questions that you have. So I don't see any currently in the queue, so we'll just go ahead and keep moving forward. Our next presenter is David McCluskey, and he's the leader of a statewide nonprofit entitled David's Fight. So he's going to be here just to tell us a little bit about the resources that are available from his organization. He has a really great story, so I'm excited for him to share that. So, David, are you on?
I am.
All right, take it away.
All right, great. Like Rachel said, my name is David McCluskey. She asked me to add a picture so that everybody can put a name to a face. So if you're not a Packer fan, I don't apologize, and hopefully you enjoy that. That was from this past year. Anyway, I'm a 6-year, well, actually this Saturday I will be a 6-year rectal cancer survivor. And during, it was a rough battle for me. We caught it early. I was a stage 2, and we caught it through colonoscopy, and luckily my family practice doctor recommended right away for me to get a colonoscopy. So went and did that, and went up to fix a hemorrhoid, and we came out with a tumor, and my life changed from that moment on. So it's been a heck of a battle the last 6 years, but I'm really happy to be here and be involved as much as I am with raising awareness and hopefully saving lives. During my oncology treatments, I always say the first thing I would do is I would go in the oncology room and look for somebody who was my age, and very rarely would I find somebody. I was diagnosed at 38. Every now and then I would, but one day I walked in and I met a gentleman by the name of David Kinman, who was unfortunately diagnosed with stage 4 and was really at the end of his battle. We didn't know it at the time when I met him, but this was in April of 2007, and we developed a pretty good friendship, but we lost him. He took a turn for the worse in May, late May that year, and he passed away in July. So my wife and I and David's wife, Brady, decided to start a foundation in his memory, and we named it David's Fight. And you'll notice it's not really, normally I don't use David as a possessive in David's Fight because it's kind of a story of both his story and my story, and how, unfortunately, if you don't catch it soon enough, you might, you'll end up later stage, and if you do catch it early, then hopefully you'll end up as lucky as we are as a family. So we started David's Fight in July of 2007. We are a nonprofit tax-exempt organization, and you'll see our tax ID number there. It took a little work to get that. My wife is a financial advisor, and she did a good job of networking and getting that all taken care of. So that happened in late 2007. We decided after kind of a lot of soul searching and trying to figure out what we were going to do, we wanted to really kind of narrow what we were going to offer as a foundation down. So our mission generally is to build colorectal cancer awareness in our communities, partnering with public physician, patient education, different programs. We partner very well with the Iowa Get Screened program, and we try and be the safety net for those that they can't get screened for if they're a high-risk individual or whatever. So a little bit more about that in a minute, but our goal is really we want to provide resources in a variety of ways, whether it be through something that we can provide directly or if we can network and find something for somebody. We try to help as many people as we can. This year we will have raised just over $200,000 over the last 5 years, and the money goes directly back into the state of Iowa. There's nobody who works with or for David's Fight that takes an income. We do this 100% volunteer. All the money that we raise goes directly back into raising awareness and into our programs. Our first program that we started is called Fighting Funds, and we help provide colonoscopies for patients who are uninsured and underinsured. There's no age restrictions, but there is some financial restrictions with that. To date, we've offered over 50 colonoscopies, and we're estimating that we'll probably offer over 30 colonoscopies this year. We usually pick up in March, but we've had 3 or 4 already this year alone. So we're pretty proud of that. And then our Snow Angels program is something I'm proud of as well. We provide for patients who are undergoing chemotherapy treatments for their colorectal cancer. They're probably getting oxaliplatin, and if they are, then there's a high sensitivity to cold. So we developed a program called Snow Angels, and we help pay for snow removal for those patients in Iowa who are undergoing oxaliplatin treatments. And they don't have to necessarily be colorectal cancer patients. We've helped pancreatic patients, anybody who's getting oxaliplatin. There's no financial restrictions on that. I'll cover that a little bit more. We have a number of different awareness events throughout the year. We've got the Bottoms Up Blues Bash that's starting up this year on March 2nd. Get Your Rear End Gear will be our 4th year, and we have a Super Colon. So I'll cover that in just a second here. But just to start with Fighting Funds, again, it's for patients who are uninsured and underinsured. There's no age restrictions. If somebody's symptomatic, we can help take care of them. There are some financial restrictions. We do require that they be 250% of federal poverty guidelines or less. And we do have a sliding scale for the number of people in the family. So we've been known from time to time to kind of bend those a little bit for borderline patients, but we try to stick to those as much as we can. We have a number of different partnerships that help us provide the colonoscopies. Our first one was the Iowa Clinic Endoscopy Center. We also have the Iowa Digestive Disease Center in Des Moines, Iowa Health in Des Moines, Wheaton Franciscan got on board in Waterloo, Lucas County Health Department, and I meant to update the slide, but up in Northwest Iowa, we do have one in Sioux Center, I think, that's helping us out as well. We do need to have anybody who's interested or wanting to get some assistance with the Fighting Funds, then they need to apply through our website, and I will cover that in just a minute too. So this is kind of the step-by-step if you want to download this, but I'm going to pull the website up and show everybody here. It's under assistance, and you'll see. So with our Snow Angels program, this is our 2nd year we're doing this. You need to be a citizen of the state of Iowa. You need to be having oxaliplatin treatments, and there's no financial restrictions. This was really designed to help the care providers out because we know that there's a lot going on in the lives of everyone involved with the colorectal cancer. So hopefully this is just kind of taking one thing off the plate, a very full plate for the care providers. We work very hard to work with the patient to find a local snow removal service that will take care of them and that they trust to come onto their property and that they trust will do a good job. Then once we get that set up and we get the quote from them, then we pay the bills directly. So that's how that works. It's pretty simple, but there is you do need to go to David's Fight and fill out a quick application, and I'll show you exactly where that is again too. So the Super Colon. The Super Colon is going to it's already made an appearance this year. It always makes an appearance to Get Your Rear End Gear, and we've got 3 different events that it's going to be appearing at. over the next month. February 28th, we just finalized that yesterday with, I think it's Pella Corporation in Carroll has a kind of a health fair day for their employees. So we'll be bringing the Super Cola in there to be set up. John Stoddard's taking advantage of it, and Mercy Cancer Center is taking advantage of it as well. So it's kind of a fun little awareness thing, and it's available. I'll bring it out, set it up, tear it down, take it away, and the $500 goes to David's Fight and back into all the programs that we offer. The first year we're having our Bottoms Up Blues event. It's really everybody who knows anything about colorectal cancer. The color's blue. We partner with the Central Ohio Blues Society. We're having it at the Valor Ballroom, and we've got a couple blues bands coming in with some barbecue, and just really make it a fun night, an all-ages event for anybody who wants to come and celebrate the lives of anybody who's been affected by colorectal cancer, not just those we've lost, but those that are fighting and have won and are trying to pay it forward. So we're really excited about this event. It's going to be a lot of fun. And no image. That's okay. This year we're moving our Get Your Rear and Gear event from October to August. The end of August is actually the week before Memorial Day or Labor Day, whatever that time of year is. I forget. Anyway, we're moving into warmer climates, we said. It was pretty cold this year, and in October, 1st of October, you just never know what kind of weather you're going to get. We've had good weather, good warm weather some years, and other years, like this year, it was freezing. So we decided to kind of move it out of October to a month that's really not as busy. There's a lot of events going on in October with a lot of different organizations. So we're very excited about the time frame when we're going to have this. It's going to be kind of a end of summer event and kicking off the new school year. So we're excited about Get Your Rear and Gear to a warmer climate. And that's it in a nutshell, really. This is my contact information. I'm going to real quick jump over to the website just so I can show you this. And it doesn't quite look the same as I had hoped on the screen. I don't know what's going on with my Internet Explorer. But I can't pull it up. Hold on. There, now it's up.
And I don't know, we're not seeing anything, David, so maybe...
Yeah, it's not there yet. Hold on.
And again, if anybody has any questions at all, go ahead and type that into the chat box, and we'll kind of gear up for the last stretch here where you can ask questions to the presenters.
There. Is that better?
Yes. Yep.
Okay. So normally there's a blue border around this, so I don't know what's happening with this Internet Explorer here, but so anyway, this is the website, davidsfight.org. To get fighting funds, you go to assistance and you just run over that, click fighting funds for colonoscopies. It kind of briefly shows what our guidelines are. And then if you click here on fighting funds application, or you can download the file over here, you'll see right here, this is what the application looks like. It's really just 2 pages and a medical release. And then we require that we get a copy of last year's tax return. So they just fill this information out real quick, send it off to us. We get back a hold of them, and we try and find them a place close to them to get a colonoscopy if they've qualified. The Snow Angels program kind of set up the same way. If you just scroll down to the bottom, you can click on the Snow Angels application or download the file over here. Real easy, just click on it. This is what it looks like. We ask, this year we're asking that everybody tries to help us out and find, we have over 55 families right now who are getting snow removal. So we've got a couple volunteers that help with that, but if we don't kind of get some direction on who to go to get the snow removal done, it takes a lot of time and energy on our part, and it just gets busier and busier for us. So we're requiring and we're hoping that somebody can help us find who to work with, and then we just ask for a physician name and signature just to verify that they're actually undergoing the oxaliplatin treatments. So that is basically that. I can't remember how to get off this. Rachel, can you help me out?
Yes, I think it should say like stop sharing in the top right corner.
Oh, it does. Okay.
Yep, you got it. Okay.
Okay.
All right. And David, so Gail posted that to remind people that people can also like David's fight on Facebook. So you do have a Facebook page, and do you update that pretty regularly with?
I do. That's a good point. Gail's a good friend. We got to meet last year in Cedar Rapids when we both spoke. And we do got a good David's Fight Facebook page set up. That's a good point with the event set up. So if you want some general information, it's there. Everything that you really need to know is on our David's Fight website as well with the forms. But we're doing a little campaign right now on Facebook celebrating the lives of those who have beaten colorectal cancer. Seems like so many times we focus on, and rightfully so, remembering those that we've lost, but I want to really celebrate the lives of those who are winning right now, too, to remind, because I know a lot more survivors than I do those who have lost. So, and then there's another question from Megan.
Yep, so Megan at Lynn County Public Health just had asked if you ever thought about contacting Bruce Moore. They do a Blues More Blues Fest, and it might be a good opportunity for community contacts or maybe some fundraising.
That's a great idea, Megan. So, thanks. If you could email me maybe some more, I'm not quite sure where Bruce Moore is on the Blues More Blues Fest.
So I think it's in Cedar Rapids.
I'm sure it probably, that's what I was thinking too, and she's typing that probably right now.
Yes.
That's a great idea. I'm really trying to connect a little bit more on the eastern side of the state. We've connected in Waterloo, and I'd really like to help maybe find some providers in Lynn County and Johnson County to help service the patients on that side of the state, so they don't have to come all the way to Des Moines to get a colonoscopy. So.
Great. All right.
Closely with Jenny and Jeanna at the Iowa Department of Public Health, and in those areas that have an Iowa Get Screened program, we really do like to help and act as a safety net to help screen those patients that are the high-risk patients. And you know, we have no age restrictions for our colonoscopies, and we really want actually to get those patients who are younger and symptomatic to get screened right away with a colonoscopy. So keep us in mind for that.
And David, this is Jenny, and thank you for bringing that up, because I didn't want to, I guess, willingly offer your services without getting your permission first, but you guys have been great, and obviously with, being federally funded, we have many restrictions with who we can and can't screen, which can get frustrating. We're very thankful for the funding we have. However, we do have a lot of limitations, especially when you get to the nitty-gritty average risk versus increased risk versus high risk. And David's Fight has been great at, like you said, being a safety net and helping us screen more individuals that we can't necessarily screen through our guidelines. So thank you.
And David, this is Rachel. I had a question about, are there other Get Your Rear in Gear locations across the state of Iowa for people who might be, in the far northwest or far northeast?
There are actually. I've helped quite a few of them kind of get up on the ground and running. None of the funds that are raised at any of the other Get Your Rear in Gears are actually going to David's Fight. But there is, if you go to the Get Your Rear in Gear website, there's one in northwest Iowa, there's one in Muscatine, northeast Iowa, I think in Waukon. There's one in Muscatine. There's going to be one this year in Centerville, and then the one in Des Moines. And I'm really hoping that we can get one off the ground in either Iowa City or Cedar Rapids, or if we could move them back and forth from Iowa City to Cedar Rapids, Waterloo. I'm happy to help. Certainly not going to run it, but I'm happy to help mentor anybody along to help get one off the ground. They are really great events, and I think a lot of it has to do in the planning. And I think we've done a good job in Des Moines with our planning, and I understand that, boy, it's a long way for people to come, and we'd certainly like to get more events out in the rural areas and in other corners of the state as we move forward. We're a young organization, so we're trying to get off the ground. And again, we've got limited funding, so we certainly would like to get some more events throughout the state and get more people involved.
That's great. So Laura Weinerad had a question just about if there's any press releases that are available, just kind of about general colorectal cancer awareness and screening that potentially Iowans could place in their own local papers next month during March.
You know, we do have some templates. We have one from last year that our public information officer actually had created and released to the public. She's actually out of the office right now, but we're definitely looking at creating some templates of press releases that people could actually use. So those will be available. So if you want to just get in contact with me, I don't know. We don't have anything right now, but we're working really hard and fast to get a lot of our activities, such as a proclamation, press releases, things like this. We're trying to get all these finalized yet within the next couple of weeks so that everything's ready to go for March. So Laura, I do have your email. You can either shoot me an email or I can try to get in contact with you about getting a press release to you as soon as we have one available. And if anybody's interested, I mean, they'll come out from the Iowa Department of Public Health. We can see if we can have them go to all the local public health departments as well. But if somebody wants something specifically, then just feel free to get in touch with me.
That sounds great. And Laura's one of the consortium's community assistants, so that would be a great way to disseminate the information through Iowa's regions too. So
I agree.
That would be great. All right, questions here. So again, just thank you to today's presenters for sharing these wonderful resources, and we just wanted to thank everybody who joined today and wish you the best in your Colorectal Cancer Awareness Month activities. So if you do have any questions about getting started or just are wondering what you can do, feel free to contact the consortium, and we can again link you to David and Jeanna and Jenny to find some resources for you. So thank you very much for attending today, and please remember to fill out your evaluations and check out canceriowa.org for some upcoming webinars. Thank you, guys.